We're continuing our partnership with Learn Liberty this week, and joining me today is an assistant professor of philosophy, politics, economics, and law at the Jepson School of Leadership Studies at the University of Richmond. Jessica Flanigan, welcome to the Rubin Report.
Hi.
How are you?
Doing well. Yeah, let's learn some liberty.
Let's learn some liberty. It's kind of funny. We're going to talk about a whole slew of things here, but medical ethics are involved. And as we are taping this, at this very moment, there is a massive wildfire about 45 minutes from here. The smoke and soot outside right now, that's even seeping into the studio at the moment. I was just sneezing right before we started. I can feel it in my lungs. Are you feeling it at all?
Yeah, no, it's pretty intense out there.
Yeah, you were going to walk here from the hotel, which is only about 4 blocks away, and you were like,
no, yeah, I bailed.
Yeah. So there's something about medical ethics or something with smoke and fire, or as you said right before we started, maybe that's more environmental ethics, perhaps?
Yeah, I don't know what it is out there, but
yeah,
it's a lot.
It's a lot. All right, so we're going to talk all sorts of things, but let's start with medical ethics.
Sure.
We talk a lot about healthcare in America, and there's this sort of endless, crazy debate about Obamacare and Trumpcare and single payer and all the buzzwords and phrases. What do you think we're really missing when it comes to the general healthcare debate? Or what do you think of the tenor of the healthcare debate in general?
I think a lot of what people focus on in the healthcare debate is with regards to access with health insurance. Like health insurance, should we have single payer? Should we have free market healthcare? And I think that's an important debate, and that's been the focus of a lot of political philosophy and a lot of kind of political conversation about healthcare. But one thing I think we overlook are kind of clinical ethics, like the ethics of what happens within that clinical context, within the system, setting aside who pays for it, how we pay for it, things like pharmaceutical regulation, drug policy, public health issues. So I think that a lot of times people will sort of think about public health more in an instrumental way of like, how do we promote the public health? Like, what's going to save lives and balance in terms of public health policy? But not asking the broader question of should we be involved in thinking about public health as the kind of thing that public officials should be promoting? So those are some things I think are overlooked. So things like regulation, public health ethics, criminal justice and health, like how those two areas of policy intersect. And the clinical context, informed consent, self-medication, things like that, things that happen in the doctor's office.
Yeah, so I want to dive into all of those things for sure. So in terms of just the general idea of healthcare, are you for having the government have people buy into the exchanges and all that?
One thing to say about the United States system is like, here's like a place where like everybody can totally agree. Like, this is not the ideal system. Like, one thing we can all agree on.
That was going to be very hard to have everyone agree on something, and I think you might have done it.
That this is not a good system.
Yeah.
Whatever your favorite system is, I think this is like a non-ideal solution.
Yeah.
It's like very robustly bad.
Is there a system that you look at elsewhere and say they're really doing it right?
I mean, not really. I think that a lot of other systems have advantages and disadvantages that we could learn from. I think that it's sort of a weird historical accident that we have this crazy Rube Goldberg of a healthcare system that we have here. I think that Australia may be on the right track and having like a kind of basic minimum, but then like markets on top, although my impression is that they don't really do like drugs the way that I would like with respect to allowing more price competition in pharmaceuticals, but I kind of favor a more market-based approach, is my own view. But again, because we have a global marketplace, like the markets themselves are like not ever going to be necessarily what like your ideal of a market would be for healthcare.
Yeah.
But the first question you asked was like, should the government be requiring people to buy health insurance?
Yeah.
I don't think that they should. I think that how having health insurance fits into a person's values isn't really a choice that a public official is like well placed to make for everybody. It might be the case that people don't benefit dollar per dollar for health insurance as much as they do for just having the money. And so I think like a good benchmark for like, is this a good policy is, would a person benefit more if you just gave them the money instead of like spending the money on them, or requiring them to spend the money on a certain thing, spend their own money on a certain thing? I also have written elsewhere about, so that's like about individual mandates or individual requirements to pay into healthcare systems in particular. I've also written elsewhere about like employer mandates. So should employers be required to pay for health insurance if they have more than 50 employees for their employees? I don't think so.
Where does the 50 number come from?
I think that's just in the Affordable Care Act. It's like, or it was, I don't know how it's being implemented now, but it was about the time that I wrote that paper about it.
Right. So the implication being that if you're that big at that point, then it's something that the government should handle?
No, that then they could mandate that employers provide health insurance to their
that
employees.
Over 50 you have to mandate.
Yeah, for larger employers. Right. And I think, well, one thing I think is that freedom of contract is an important freedom. And I think that when the government says, oh, you and I, we could negotiate a contract, but the contract has to contain certain terms, like a certain wage or a certain provision of benefits, I think that would violate individual people's freedoms of contract. And so I think people should be able to make labor agreements under whatever terms they want, for the most part. And so the requirement that the government could say, like, well, you have to pay people in health insurance, and that requirement would fall on people who are employing people who are already benefiting them much more than any other random people in the community are benefiting these employees. I think that would be a violation of freedom of contract. So yeah, I'm sort of against both. Yes, I am against the individual and employer-based mandates because I think that we should trust people to decide what in their contracts or in their personal spending choices are best for them.
Yeah. So in a weird way, as at least a one-time Obama voter, right? You voted for Obama at least once?
Yeah.
Yeah. That sort of puts you a little bit at odds with Obamacare, though, or not a little bit. That kind of really puts you at odds with Obamacare.
Yeah. No.
Yeah. So is that something you really struggled with as you were voting for him? Because right, I mean that's really his landmark piece of legislation, right? I mean that's the thing that he'll most likely be remembered for the most.
Yeah, I think why do people vote the way they do? I mean, a lot of reasons. But no, I disagree with the Affordable Care Act. But so I mean that's one thing.
Did you make any sense of when they were trying to pass Trumpcare or whatever his version of or now even they're scaling back little bits of it or they're defunding parts of it. It's hard to pay attention or not even pay attention. It's hard to track actually what the real world resolution is with this stuff. Did you see any goodness in any of that they were scaling back some of it?
I mean, it was changing like every week. It was like hard to even keep up when that healthcare debate was happening. My impression was that it was worse for people in that it like didn't really solve the fundamental objections people had to the Affordable Care Act, but that it created other problems in the markets, in the exchanges. But
so what do you do in cases of if you let it completely free market and you didn't have companies have to do anything under 50, over 50, whatever it is? What do you do for all the people that will just be left behind? I mean, all the people that were either just flat out dying because they weren't seeing a doctor,
right,
or the people that were then going to emergency rooms, which we know the costs of doing that are actually way higher than if they had care when they should have. What's the free market sort of answer to that?
Yeah, it depends on whether or not. So oftentimes people will say healthcare is a right, and what do you mean by that?
Bernie says it all the time. Ted, do you think healthcare's a right? Healthcare's a right. I believe it.
What do you mean by a right? So you might think that a right is always enforceable. If somebody has a right to something, then they have a right against other people to provide it.
To be clear, you don't think it's a right, I don't think, right?
Well, I just think it depends on what you mean by a right? But I mean, I don't...
Right, I mean, we have the right to life, liberty, and the pursuit of happiness, and we have the Bill of Rights, but I don't think there's anything in there that says you have the right to health care.
Certainly not an enforceable right, a right that other people provide you with it. I'm skeptical of that claim. And so what would it mean for there to be an enforceable right to healthcare? What would it mean for there to be a right that you had to claim that another person provided with you? Well, it means that you could use the enforcement power of the state. Public officials could use their enforcement power to compel other people to provide their compatriots with healthcare. And then my question about that is, why healthcare? Like, why is the thing that people are required to be providing their compatriots healthcare and not something like a basic income, which I do support. Like, I do favor basic income, or they could kind of decide how to allocate their resources themselves in accordance with their own value, or providing people with something like a basic standard of well-being, and then like if you wanted to like provide people with a set standard of well-being, a set of opportunities and health outcomes, it's not clear that like having them buy health insurance or have health insurance would be the thing that would promote that. So and it's not even saying like health care is the right, it's like health insurance is the thing that people are saying is the right. And so in order to establish that there's an enforceable right for the public officials to compel people's fellow citizens to provide other people with health insurance, it would have to be that health insurance in particular was this thing that was so important for like human autonomy, flourishing, and well-being that it could warrant like coercively compelling people to provide it. Now, once we have that as our bar, like this is the bar, like I think a lot of other things would clear such a bar before health insurance would. I think it's like this,
what, for example?
Well, a basic income for one. I think that like having some kind of floor of material security would probably.
So basically, once you've said this is a right that we should have, there's a whole bunch of other things that using that standard you think would
be on the
over
list
it.
before health insurance, right? And so if you think that there's an enforceable right that people should have health care, you'd have to explain in virtue of what do other people make themselves liable to be coerced by the government in order to provide their fellow citizens with that right. In virtue of what value? And whatever value that is, I would worry that there'd be like a lot of other stuff we'd be putting on the list before health insurance.
Yeah. Is there also like a part of it that it almost oddly sets people up against each other in a weird way? So if you take good care of yourself and you exercise and you eat right and you pay into the system and you're healthy, but then you go to the supermarket and you see someone buying a ton of soda and eating horrible foods that's overweight, never exercising, all that, you know that they're going to be more of a strain on the system than you, and you're basically paying for them. You know what I mean? And so it would make you sort of almost angry at people for not taking care of themselves because they're then expending the resources that you're putting into the system because you're living better, so to speak.
I do think that there is sort of a link between support for like kind of spreading across the cost of healthcare and support for public health paternalism. I think that is the link, which is that people think that if they're paying taxes to support programs that are going to provide health care for people, that gives them an entitlement or a stake in the health of other people.
Right.
But then think it through. So say that you do think that health care or health insurance is an enforceable right, that everybody has a right to it no matter what. Then people don't make themselves preemptively liable to have their other liberties limited on the grounds that in virtue of their choices, their permissible choices, they're going to make it more expensive to enforce those rights. So by that I just mean like, say that you're a person that just wants to eat like Doritos and Coca-Cola all day, which is delicious.
Reminds me of college.
I'd be sympathetic to that view. And then people say, well, like, no, you can't just do that, or you can't smoke cigarettes because if you do, then we're all going to have to pay for it. Well, then you might say, like, but wait a minute, like, who cares? Like, you have an obligation in virtue of my enforceable right to pay for it anyhow. And so, like, you don't get to tell me what to do just because subsequently you're going to have to give me what I'm owed, which is high health care. If you owe me $50 and you don't like how I'm going to spend the $50, you don't get to tell me to change my behavior before you give me the $50.
Right. I just think it's not an enforceable concept, but it's just, I think it would just cause resentment. I think in general, like if you're just like, I don't expend a lot from the system. I don't take a lot from the system. And here are other people that do. It's just sort of human nature, I think.
To resent, like...
Yeah, to sort of resent it. Yeah.
Maybe. I mean, I don't think that they should if they think that they have a duty to provide it.
Right. Well, I don't know that people really think it through all the way. And maybe a certain amount of people don't think they have a duty to provide it in the first place.
And if they don't think they have a duty to provide it, then their issue isn't with the people eating Doritos and smoking cigarettes. Their issue is with being forced to provide other people with health insurance, which is, a different gripe. So like, either way, if you don't have any kind of grounds to resent or to want to limit the freedom of the people who just want to smoke cigarettes and eat Doritos, because like, which I feel like I'm like hating on Doritos here.
Yeah, let's not make this about Doritos. Everybody loves the Cool Ranch.
Which, right? But so I feel like if you're a person who thinks healthcare is a right, then you have no grounds to want to limit the choices of those people because you, by your own lights, think that you have a duty to provide them with healthcare, whatever their choices are.
Right.
And if you're, irritated by people making making choices that could be prevented with public health paternalism that you disapprove of, on the grounds that you don't want to pay for their health insurance, then what's doing the work is really just that you don't want to pay for their health insurance. And so then you also don't have any real beef with people making bad health decisions.
Right,
and so either side, I don't think, should support public health paternalism.
Interesting. You've mentioned cigarettes a couple times. It's funny because literally my chest is tight right now. I don't smoke cigarettes, but from the smoke outside, like I can feel it at this moment. And I always think the cigarette thing is kind of interesting because I used to live in New York City, and I'm pretty sure cigarettes were something like $12 or $15 a pack, like taxed beyond imagination, which I always thought was an odd thing because it's like you're taking people with this vice and then, and an addiction, a true addiction to tobacco and all the other stuff that's in there. And then you're making all of this extra money off it that the government then needs to do whatever it's doing. Yeah. So it's like a doubly abusive thing in a way. Not that you should just be giving cigarettes away for free, but taxing these vices, these addictive vices, you're just taking more money from those people and putting it, now you're gonna need, the government never wants less money, so it's never gonna be like, all right, we're gonna tax that lower or we're gonna stop spending.
Yeah. There is some evidence that cigarette taxes do reduce smoking, which makes sense unless you think that cigarettes are sort of this like uncontrollable compulsion that people have, which would be interesting then that if you increase the price of it by $1, then people stop doing it.
Right.
So then it looks
but then
like
you're
it
also
is more
saying
volitional.
you're saying poor people, then it's probably poor people that then can't afford it. So then it's like, well, poor people shouldn't be allowed to smoke cigarettes, which I think some people would have an issue
If that
with.
is the way it goes down, I don't know. But I do think that sin taxes in general, or like cigarette taxes on things that the government doesn't want people to do, like soda taxes are another example, they are regressive for sure. I mean, just because, the marginal value of that dollar is going to be disproportionately, the marginal impact of being taxed an additional dollar will be disproportionately harmful to people who have less money.
Right.
And so we have these regressive public health taxes that are going to disproportionately burden the economically worse off. And I also think that they're very expressively harmful because they express disapproval of certain people's choices on behalf of the government, which it's not morally wrong to smoke cigarettes. It's not morally wrong to drink soda. And so I don't think that the government should be expressing disapproval or limiting people's rights to make choices that are permissible.
Right. And yet I think there's some sort of argument that says if the government's going to give health insurance to everyone, that maybe then at the same time the government has a right to tell you, I don't agree with this, but I can see the argument, though, that, all right, the government's going to give health insurance to everyone. Well, then why can't the government say, you know what, and you can't smoke cigarettes and you can't drink soda with high fructose corn syrup because we know it's going to give you diabetes, which is also going to be a strain on the system. Again, I don't agree with that, but I can understand that line of thinking.
Yeah, if that were the argument, then I would think that then you should let people opt out. So it'd be like, hey, free health insurance in exchange for not smoking or drinking soda or exchange for exercising or something. I don't think people would be on board with that, though. I don't think that they would like it if there was a policy of making the provision of public services conditional on people behaving.
Right. You'd have a black market, basically, of soda. People would be secretly smuggling soda.
Or, I mean, what I was saying was like, maybe if taxpayers like, oh, we don't want to pay for people's health insurance if they're going to make these bad choices, that still doesn't justify banning the bad choices because you could just say, if you want to get, publicly subsidized health insurance, then you can't make these bad choices. Then you can't smoke, or then you can't drink soda. Yeah. I don't think people would accept that. I don't think people would say that that was their ideal of a publicly provided health insurance system, where it's like, if you want to, where people would have to voluntarily limit their liberty in order to have access to it.
Yeah.
I don't think that most people who support like Medicaid for all would support a system where Medicaid for all, but people can opt out of it in exchange for the right to smoke cigarettes.
Right. It's interesting because I would always veer on more choice. And yet we find ourselves in a place where it's like, well, people are going to do bad things and you're just going to sort of have to pay for it if we have less choice. It's just how it is.
Wait, so go through that argument again?
That if you have less choice, meaning the government's going to make you have health insurance or whatever it is, that people are going to do bad things, and you're going to sort of have to subsidize it. It's just
or
how
ban
it is.
it, right? I mean,
or ban it, which I wouldn't be for banning it. I wouldn't be for banning it.
Yeah.
It's an interesting thing. I mean, in the cigarette one, I think it's particularly interesting because the government, you're saying, this is something bad. We all agree this is bad. The government's now going to make a lot of money off something bad, and it wants money. So it almost wants you to smoke cigarettes. You know what I mean?
Yeah, I don't know that the government wants people to
But they
smoke
want
cigarettes.
that money, and they know it's a way to make money, right? I don't know that I don't think they're sitting in a thing going, we got to get more people smoking cigarettes. But when they look at the numbers and they're like, wow, look at all this money we took in from cigarettes, I think they probably view that as a good. They want more money.
But I think at the same time, public officials are definitely invested in reducing long-term healthcare costs and reducing rates of smoking. And so, I mean, it's hard to, like, I think people often use this idea where they're like, the government does this or like the government does that, but like there's not one thing that like is like the government, right? It's just public officials with different kind of motivations. And so, but I don't think that many public officials are motivated of like, oh yeah, let's raise money through cigarette taxes. I think that the primary motivation of people who pass cigarette taxes is to deter people from smoking.
Right.
But I don't think that I don't even think that's a good motivation. I mean,
right. I don't know which the primary motivation is. I don't really like either one of them.
Yeah.
All right, fair.
Like, it's bad enough if they're just like, oh, we want to like cast judgment on people's permissible choices in order to discourage it. Like, I think that that's like, I mean, I think that's sinister enough if you want a reason to oppose the cigarette taxes.
Yeah. All right. Well, I think we hit the basics of sort of the main public policy stuff that I wanted to get to. Let's talk a little bit about medical ethics in general. Define medical ethics for me.
What people ought to do in healthcare and medical contexts.
And you want people to have more choices than they currently have.
That's right. Yeah. So I wrote a book, Pharmaceutical Freedom.
Yeah.
Christmas is coming. Makes a great gift. Just saying.
We will have a link in the description down below.
And the argument for the book is that the same reasons in favor of informed consent, which is a core principle of medical ethics, are also reasons in favor of rights of self-medication.
Yeah. Wait. Let's define some of the terms. So informed consent is
that physicians are not entitled to make medical decisions on behalf of their patients as long as their patient is competent. And patients have rights against being coerced into making particular medical decisions. Medically competent patients are, not children. And that it's also impermissible for physicians or anyone else to deceptively mislead or withhold information from a patient in order to get them to make a medically advisable decision.
How do you actually figure out what informed means, what the word informed means? I mean, when I've been to hospitals with grandparents sort of at the end of life and when they're trying to do the last few things that they can do and they say, well, we can do this or that or, you know, all these different things, they're explaining it usually to you, but you don't really feel informed. Like you really don't know unless you're a doctor yourself. So how do you actually define what informed really means?
Is that the patient should be informed up to this kind of reasonable patient standard? So like what a reasonable person would deem relevant to the content of their decision. And so that includes both information about the risks and benefits of a particular treatment, but also information about treatment alternatives, and also information about the risks and benefits of having no treatment, of declining treatment entirely. So that's the sort of broad standard of what level of information is required for a patient to have access to. Some patients might want to not know certain information. This is becoming increasingly an issue with things like information about genetic risk factors, for example. And so then patients should have the right to also kind of consent to the uncertainty, perhaps. And so say like, well, we could disclose genetic risk factors from this analysis unless you don't want to know. I think
so in effect, you then would be opting out,
That's
and
right.
then you were sort of waiving any of your legal rights, I assume, after.
I don't know what the legal context is, but I think morally patients should be entitled to essentially exercise as much control over the amount of information they want with respect to their medical choices, and also to have unrestricted access to whatever information they would deem relevant to their medical choices, but that doctors should be on the hook to provide patients in the context of medical decision with whatever information a reasonable patient would want to know about the risks and benefits of treatment, treatment alternatives, and no information, or no treatment.
Right, but in effect, though, you as a patient could say to your doctor, there are things that I will not want to know. And your doctor...
Yeah, my own view is that that's true, that like patients should be able to opt out of knowing, although they will have to re-up.
What would be an example of something like that?
So I think that the the primary example where this is an issue is with testing for genetic risks. So if physicians know that a person has a latent life risk of a certain disease, should the physician be required to disclose it to the patient? And I think that the physician should be required to disclose that the test might turn up certain diseases, and then ask the patient if they want to know, because some people might prefer to live in ignorance of that type of knowledge. That's controversial in medical ethics, whether or not patients should have a right to know. But informed consent is less controversial outside of those are kind of marginal cases.
Right.
So like outside of those more marginal cases, we're all familiar today with what informed consent requires. So you go to the doctor, you say treatment A, treatment B, what are the risks and benefits of the two? And the main idea of informed consent is that you are the author of your own medical choices. You're the person that's in the driver's seat, not the doctor. And so the doctor can't trick you, mislead you, withhold information, or coerce you in order to get you to make a decision that the doctor thinks is medically advisable. It didn't always used to be this way. So the emergence of informed consent happened in the 20th century. Before then, physicians were very paternalistic towards people, and even well into the 20th century. So there was a survey done in the late 60s of oncologists about people who were diagnosed with cancer, whether or not they always accurately revealed the diagnosis. 90% of oncologists said that they did not always accurately reveal cancer diagnoses to their cancer patients.
Meaning that they were confused
That sometimes
at
they
the
would
results in the first place?
that they would withhold a diagnosis from patients paternalistically for fear that the diagnosis would be harmful to the patients if they knew it. Sometimes even substituting in an alternative diagnosis. I know this was 1968, I think the study was. So informed consent.
Explain that a little further. What would be the legitimate, if you were an oncologist and you knew that one of your patients had cancer, what would be the argument for?
At the time, they thought that there was, at least in some cases, the oncologist would withhold or mislead patients about their diagnosis on the grounds that they thought that the information about the diagnosis would be harmful to the patients.
Wow, I mean, that's incredible.
Yeah, but now we think that that sounds bananas.
Yeah.
I can't believe that was just very recent. So informed consent has only robustly been with us for the past 50 years or so in this way. And now it's baked in. We all understand, like, yes, it is wrong for doctors to mislead people or to lie to people about their diagnosis. It's wrong for doctors to coerce people into accepting surgery. So the first informed consent case was in 1912, 1913. And it was a case where doctors performed a hysterectomy on a woman without her consent. She actually explicitly said that she did not consent to surgery. Then she was being examined under ether, and the doctors removed her organs. That doesn't happen anymore, or when it does, it's like a big deal. Like it's medical battery, it's a form of assault. So we now think about patient choice and people's control over their health in a much more respectful way, I think. That's been like a sign of moral progress. Like I believe in moral progress, that the world's, capable of morally improving. I think this is one example. At the same time, however, across the 20th century, patients slowly lost rights of self-medication. So while over the course of the 20th century, patients were gaining the authority in the doctor's office to make medical decisions for themselves, they were losing that authority at the pharmacist. And so the book is about why the same reasons that give patients the authority to make medical decisions about their own bodies in the clinical context are also reasons in favor of giving people rights of self-medication in the marketplace and in the pharmaceutical context.
So how did we lose control of some of that related to the pharmaceuticals?
Well, there were a series of drug disasters. First, elixir sulfonamide in the 1930s, and then the thalidomide disasters in the 1960s, which the United States avoided because of a regulator at the FDA who was very cautious in approving the drug application for thalidomide. Those drug disasters led, at both times, for public outcry for increased pharmaceutical regulation. First, for
Can
safety.
you tell me a little bit more about what the drug actually was?
Yeah, so elixir sulfonamide, sorry, there's like fires outside.
I mean, I'm feeling it right now. We're in a health crisis right now while we're doing this.
Elixir sulfonamide was essentially an anti-infectant that was diluted with something like antifreeze. And it was distributed in the 1930s. And when this drug was diluted in this kind of antifreeze-like substance, diethylene glycol, a lot of people, mostly children, died from taking it. And after the children died from taking it, there was a lot of media coverage. The drug was recalled. There were lawsuits, but there wasn't really much of a legal basis for punishing the people besides the fact that it was mislabeled. And so there was public outcry against the fact that this very dangerous medicine was being distributed to people and they didn't have an opportunity to consent. The initial drug regulations that passed authorizing the FDA stipulated that it was only intended to make self-medication safer and more effective. So in the 1900s, rights of self-medication were widely affirmed. People believed in rights of self-medication. And the initial regulations that were passed were just supposed to be like labeling requirements, making it so people could be informed about what they were taking. But the approval process quickly evolved into a safety standard, requiring pre-market safety testing in order to establish that people knew what they were getting when they were taking a drug. By the 1960s, when the thalidomide disaster happened, which was a drug that was used by pregnant women to treat morning sickness, and then it caused miscarriages and then some children to be born without limbs. It mostly hit in Europe, and we avoided it because of our drug approval process in the United States. By this time, the FDA became a kind of model for the world about drug regulation, and that still is true today. So a lot of other countries kind of mirror the regulatory approach off of the FDA. And the United States avoided it because of regulatory caution with respect to a new drug application. But seeing the pictures of the infants that were born without limbs from thalidomide, there was once again a great deal of public support, and the FDA passed, the Congress authorized the FDA to enforce efficacy testing requirements as well. So now, in order for a drug to be brought to market, it needs to be shown that it is both safe and effective before being brought to market. That sounds like a good idea.
The road to hell is paved with good intentions. Continue.
But now say that the FDA approves a drug and it says, you know, we fast-tracked this drug, it got approved very quickly, we approved it, you know, from basic research to approval 5 years, which would be very, very fast. And now we expect it to save 10,000 lives a year. The way that you should perhaps hear that is that tens of thousands of lives were lost during every year that approval for the drug was withheld. People see the children who died during the elixir sulfonamide disaster, the thalidomide babies, but people don't see the people who look like they were dying of their diseases, but they were actually dying because of regulatory caution.
Because they couldn't get access to drugs
exactly
that could potentially help them.
Yeah, it's not as vivid to us when people die for a lack of access to drugs. But it really is the case that though it looks like their diseases are what's killing them, what's actually killing them is the lack of access.
Yeah, so this is kind of a tough place for someone with certain libertarian leanings like yourself to be in, right? Because you're acknowledging the FDA did some good work in the first place here, but then that, right? Like, right? I mean, I think you are, I don't want to put words in your mouth, but you're acknowledging that by having this regulation at first, it stopped it from coming to the United States, correct?
Well, I mean, I don't even think that necessarily, because the approval process for the drug wouldn't have even been for pregnant women. Most pregnant women use drugs off-label. I think that people saw it as a win for the FDA because the FDA didn't approve the new drug application, and so the United States largely avoided the crisis. But I don't think that the current system would have prevented a crisis like thalidomide in the United States, because very few drugs are approved for use in pregnant women. And so it's like sort of this weird historical accident. Like, I don't know that we should credit the FDA in this way for like intentionally preventing that. Now, so like when you're like, oh, you credit the FDA with certain things, I do think one thing the FDA does that is good is that it enables informed patient choice. It certifies drugs. So my view is, like, if you like the FDA, which I know a lot of people do, it's one of the most popular regulatory agencies, fine, let it do everything it does now. Let it certify drugs, like the Good Housekeeping seal of approval. I also think there should be other certificatory agencies for drugs. It's like when you go to Whole Foods and there's like 15 different certifications on all of your different eggs.
They got a lot of things on those boxes.
Yeah, let any drug have all sorts of certifications, but including, as we have with food, like USDA, like let them certify drugs. What I object to is the FDA prohibiting drugs, which they have been doing for a long time. And so withholding access to drugs, I think, violates people's rights. It's a violation of their rights to make decisions about their own bodies.
Yeah. Are there any particular drugs at the moment that they're withholding that you think are real game changers?
I mean, it's always hard to know. I mean, that's the reason that they do withhold it, is because there is high uncertainty for unapproved drugs. There's also high uncertainty for approved drugs, but
yeah, I wanted to ask you about that actually, because everyone knows. I mean, it's a joke that everybody makes. You turn on the TV, you watch any commercial. Half the commercials these days are for prescription drugs. They tell you a little something good about it at the beginning, where the guy's running in the field and everybody's happy and he's on a mountain. And then the 3/4 of the commercial really are about the diarrhea and vomiting and upset stomach and thoughts of suicide and restless leg syndrome and blindness and a gajillion other things. So something seems wrong with the way we are medicating ourselves, or the way that these things get passed. It's almost as if our bodies are telling us not to be on half of this stuff, not to say, I have friends that are on different things, and I had a friend that was really helped by lithium and a bunch of other things, but that there's some odd thing that we're doing with over-medicating, or that we push this stuff on ourselves constantly.
Whether or not a person should use any kind of a drug is a decision that should just be made in terms of the risk-benefit calculus for their own life as a whole. And who's the expert about your life as a whole? You are. And so what happens with the FDA is that they impose these broad-based judgments that apply to everybody when they prohibit a drug or when they withhold access to a drug before approval, that say that the drug is unacceptably risky. And then when they approve a drug, they say that this drug was approved because the risks are acceptable in light of the benefits. Now, that's not a scientific judgment. That's not a judgment that the FDA is well placed to make. Whether or not something's acceptably risky is a normative judgment. It's a judgment about what you should do with your own life and your own body. So medical experts, doctors, pharmaceutical regulators, public officials are not experts about whether or not something's acceptably risky. The person who's an expert about whether it's acceptably risky is the patient. Now, you seem to be saying, like, well, patients are taking too many risks, like they're using too many drugs.
Well, it seems like we're inundated with so much of this that everyone, I mean, I think we're the most over-medicated country in the world. I'm not, you can correct me if I'm wrong, but I think it's something, like, I don't think, isn't it illegal for some of these commercials to be on all the time in Europe? I'm pretty sure they have laws against some of this stuff. And yet for us, we're slammed with it constantly. And I think that causes your ability.
Do you think that that's bad, that there's so much pharmaceutical advertising?
I'm not for overregulation, so this is one of the places where it's a struggle, right? Like, I'm trying to be intellectually honest here. I'm not for overregulating these things, and I'm always for more choice, so I understand the argument. But the general, allow me, please. But the general idea that we're slammed with so much of this that it makes your ability to make a clear-minded choice more difficult. And we're going to talk about critical thinking a little more at the end.
Because I think that, well, I'm in favor of direct-to-consumer drug marketing, which the United States is one of only a few countries that allow it, and I think that's good. I think that's like part of our sort of strong commitment to freedom of speech, that we do include commercial speech to an extent within that. And I think that if the government were to say no pharmaceutical advertisings, that would be a content-based restriction against speech that advocates in favor of lawful conduct on the grounds that the government doesn't agree with the message.
Yeah, so I'm not.
So you should be worried about that.
Yeah. Trust me, I'm a free speech guy. So I'm not against it. I just think our ability. I don't know what the answer is. I'm just saying that our ability to make informed choices about the drugs that they're pushing on us all the time seems to be very slippery.
And maybe we have that slippery ability because we haven't been given the autonomy to make decisions about our own health. Maybe it's a kind of learned helplessness from the fact that currently, people aren't authorized to make choices about their own health. So given that we have a prescription requirement system where you have to go to a doctor and get the prescription, maybe people offload to physicians and then they accept more risk than they otherwise would have, because they think, well, if a doctor would have prescribed it, then it's fine. And then the physicians have this other way of looking at it where they're like, well, if the patient wants to take it, like, the risk is on her. And then it could lead to more risky decision making. There's some evidence from an economist from the 70s who did research on this, Sam Peltzman, that prescription requirements actually induced more risky decision making and result in higher rates of accidental drug poisonings because of this sort of offloading effect, where people think that if a doctor told you it was okay to take it, that it's okay to take it. So
that's really interesting to me. Right, because they're like, the doctor said it's okay, so I'm going to go ahead and do it. I don't even have to listen to the people telling me that I'm going to have diarrhea and thoughts of suicide and all the rest of it.
Where people are they take less, they're less cautious because they feel like their decisions are authorized by first the FDA. The FDA approved it, it's an FDA approved drug, and then by their doctors, and so they're more likely to take on risks associated with using these drugs.
So in an odd way, by removing some of these restrictions, it would actually strengthen the doctor, you think, because it would be on the person to then take the responsibility for themselves.
I mean, I've talked to some doctors about this, and they kind of, like, you might think that doctors would be like, oh no, we need to keep prescription requirements. But they think right now, look, maybe I could focus more on patient care. Maybe we could, focus more on really having a conversation with patients who want advice from a doctor. I'm not saying people shouldn't talk to their doctors before making decisions about which drugs to use. I'm saying that after they talk to their doctors, the decision should be in their hands. And that if they don't want to talk to a doctor, that's also their decision.
Yeah. Well, you're also saying actually listen when they list all of those side effects.
Yeah.
Because I think that's part of it. Like, you don't even listen to that part, and it's why their marketing is so good. All these people are having a great time while they're on Valtrex, you know what I mean? And then you find out what all the side effects are, but you don't really, oh, well, that won't happen to me,
Yeah, I think that, patients should have the autonomy to take responsibility for their health, have the authority to make decisions about themselves, and they should take that seriously, and they should educate themselves. And I think that also they should have access to the relevant information. I don't think that, I would favor, fair labeling requirements, making labels accessible for people to be able to understand the risks and benefits of the treatment. Mm-hmm. But ultimately, whether or not a decision's acceptably risky, whether the risks outweigh the benefit, no one can make that decision for a patient except for the patient.
Yeah. All right, so the through line here, I think, is more choice. Fair to say?
I'm usually going to be in favor of more choice.